Hi everyone, this is Sujata. In this video, we will talk about aorta and its branches. The aorta is the largest artery in the body. It is composed of four major segments, which are the ascending aorta, arch of aorta, descending or thoracic aorta, and abdominal aorta. The ascending aorta arises from the left ventricle. It gives rise to the right and left coronary arteries, which arise from the right and left aortic sinuses, respectively. The arch of aorta gives rise to many critical branches. It gives rise to three direct branches, which are the left subclavian artery, the left common carotid artery, and the brachiocephalic trunk, which is also known as the innominate artery. The brachiocephalic trunk further divides into the right subclavian and the right common carotid artery. The subclavian artery gives rise to four direct branches. These are the vertebral artery, the thyrocervical trunk, the costocervical trunk, and the internal thoracic artery. It then continues as the axillary artery. The axillary artery becomes the brachial artery, which then divides into the radial and ulnar arteries. The radial and ulnar, in turn, anastomose with each other in the palm of the hand. The vertebral artery ascends into the brain through the foramen magnum, where it connects with the other vertebral artery to become the basilar artery. The basilar artery, in turn, supplies the posterior circulation of the brain through the circle of Willis. The common carotid artery will divide into external and internal carotid arteries. The external carotid artery, in turn, ends as the superficial temporal and the maxillary arteries. It also gives off the facial artery. The thoracic aorta gives off visceral and parietal branches that supply the pericardium, the bronchi, esophagus, and mediastinum. The thoracic aorta becomes the abdominal aorta after passing through the aortic hiatus in the diaphragm at the level of T12. It gives off 4 unpaired and 5 paired branches. The 5 paired branches are the inferior phrenic, suprarenal, renal, gonadal, and lumbar branches. The 4 unpaired branches are from above to below: celiac trunk, superior mesenteric artery, inferior mesenteric artery, and median sacral artery. The abdominal aorta ends by dividing into 2 common iliac arteries. Each common iliac artery further divides into internal iliac and external iliac. The femoral artery is a continuation of the external iliac artery. Let's look at a few high-yield concepts on applied anatomy of the aorta and its branches. The superficial temporal artery is commonly involved in giant cell or temporal arteritis. It presents characteristically with claudication of the jaw and scalp tenderness. Subclavian steal syndrome can result from cases of stenosis of the subclavian artery before the origin of the vertebral artery. It happens in subclavian stenosis from atherosclerosis, giant cell arteritis, etc. There is a retrograde flow in the vertebral artery in subclavian steal syndrome, which affects circulation in the posterior brain and may present with stroke-like symptoms of presyncope, syncope, dizziness, vertigo, blurry vision, diplopia, etc. Some patients may present with claudication of the upper limb. It is typically precipitated by upper extremity exercise. Other features include lower blood pressure in the affected arm and weak or absent pulses. A bruit may be heard in some cases in the supraclavicular fossa. Thanks for watching. Hope this video helps you understand aorta, what are its branches, and what is the applied anatomy. Hi, I am Sujata. If you enjoyed this video, then you will love the courses I authored for Achievable. Achievable Step 1 USMLE course is a great learning program if you are looking for high-value, information-rich study materials that use technology to help you pass the exam. I have written the course exclusively for Achievable, including all the medical content that is covered by the USMLE Step 1 exam. It includes more videos just like these to cover key topics, as well as an inbuilt study planner to keep you on track. With the help of hundreds of chapter review questions, our spaced repetition algorithm personalizes the content just for you. Our course is very competitively priced, and you can try it for free first to see if the style is right for you. Follow the links in the description below to get started.